for a minute, and you will notice that we've got some blood vessels. You can see a hole there, blood vessel. There's another one, not quite so large. And I don't make any attempt myself right now to identify which is which. I look and see where they're coming from the inside before I decide what they are. So I do this, twice a year myself, and I don't do this all day every day. But you can see that we've got a really thick-walled structure here. See how thick-walled that is? It's going to be one of our arteries, probably aorta. We'll see when we get to it a little bit further. Now I'm going to come back here, and I'm going to look, and I see that we've got a thing here. That's a funny-looking thing, isn't it? Look over here. It's hiding. Another funny-looking little thing over here. Except it's hiding. There it is. It's kind of fatty. Shows it best on this side. That's one of the auricles. Notice on the left side, the left auricle. Auricle, A-U-R-I-C-L-E. I'm not even sure I've got it on your list. That's part of the atrium. Auricle means ear. It's kind of like a little ear-shaped flap. But it's part of the atrium. That's better. Look at it again. We've got sort of a pinky brown color, and we've got sort of a creamy white color, don't we? The pinky brown color is muscle, cardiac muscle. Myocardium. The pinky white is fat, and different parts will have different degrees of fat on them, and different, slightly different thick widenesses and thicknesses. When you look at the fat, you can see kind of a groove going down there, and you can see this groove, and it kind of splits off. That's some of the superficial blood vessels, and so coronary arteries, coronary veins. We're going to have some that we can see on the outside like that. We're not going to try to name them or anything, but you do want to know that your heart has those things. Next, we want to identify what we know, apex from the base. Now we want to know left from right. To me, the easiest thing to do is I look at this heart and I turn it up like this, straight down. I have a band of pink, the muscle, going across the apex of the heart. And it makes like a V. Between the V, the arm of the V, we've got, and it's not showing up real well on this one, usually a white streak of fat. This V and the white streak of fat here are the left side of the heart, the left ventricle. Look on the other side of this V, we've got a line going all the way around, a line of white, and that is the junction between the left ventricle and the right ventricle. So it's fairly easy to identify, at least in a sheep heart. I haven't looked at a lot of different species hearts, but at least in a sheep it's easy here. And also, if you even feel of them, you can feel that's very thick feeling, and you can even feel that the right ventricular wall is thinner. You can pick that up. So we know we've got the left side. Here's our V. Do note that it's coming all the way to the apex. And what I tell you about the left ventricle, it does come further down towards the apex. Left ventricle. So I'm going to have my V, and I'm going to cut right up the middle, and you'll notice that I'm going to be going through this auricle here. And that's up in the atrial area. So you're using your scalpel blade for that. I do have one right. This heart muscle is thicker than your scalpel blade. It's going to take more than one set of slices to do this. And try to remember to make your slices fairly smooth. Don't do that to it, because you're just going to have real ragged edges. It's going to be a mess.